Thank you for the opportunity to testify on behalf of the 9 million uninsured children and the millions more underinsured children, which we have a chance to correct this year. And we've said many good things about your proposals. They're in the written testimony. I want to just limit myself to my hopes for true health reform for all children and pregnant mothers within any health insurance plan. So whatever you adopt as a health insurance plan for all Americans, I want to just make sure that all children, all pregnant women, are treated equitably and get affordable, comprehensive coverage. And what a great opportunity this is. I'm so pleased and thank you for the CHIP bill that you enacted and the President signed, and that was a significant step, but we now have a chance to finish the job. That was not true health care reform for all children, and it is not the child health mandate that the President promised. But here we can do it now. The need for health care reform that expands coverage for all children, cure benefit inequities between CHIP and Medicaid children, and establish a national floor of eligibility of 300% to end the lottery of geography across 50 states and to simplify enrollment and retention, particularly in Medicaid and CHIP, are the key things that I would hope that you will address in your final health proposal. These particularly devastating economic times when the number of poor children could rise by 1.5 million to 2 million more, the need for a guaranteed strong health care safety net to ensure their continuous access to coverage and every opportunity for a healthy start in life is absolutely urgent. I want to just address these 4 points for a brief moment each. One is I hope you will assure that health coverage is affordable for all children and pregnant women, and with a floor of 300% of the federal poverty level, which is about $66,000 for a family of 4. Just as all children in the United States are entitled to a free public education, all children should be entitled to affordable health care. The high number of uninsured children exacts a high health, economic, and social toll on these children, the families in our nation. Uninsured children are at high risk of living sicker and dying earlier than their insured peers and are almost 10 times as likely as insured children to have an untreated medical need. These consequences of untreated medical needs can carry on into adulthood, and we must prevent them. The consequences of being uninsured fall disproportionately on children of color, who represent almost 2/3 of all uninsured children. Children of color are at higher risk than white children of having unmet health and mental health and dental health needs, and they are at greater risk of being sucked because of the absence of this preventive health and mental health coverage, of being sucked into something that the Children's Defense Fund is very concerned about, that we call the cradle-to-prison pipeline. Many children without mental health services are having to be locked up in order to get mental health care in their community at an enormous cost of $100,000 and $200,000 a year. Children should not have to go to jail in order to get mental health coverage. You can cure that this year. Yeah. The need for health care begins with maternity coverage. We have 800,000 pregnant women who are uninsured and having babies every year. They receive less prenatal care than their insured counterparts. They face greater risk for expensive and tragic outcomes, including complications, low birth weight, preventable illness, and even infant and maternal death. We have about 350,000 low birth weight babies. In the most recent data, their cost is 25 times greater than normal birth weight babies. We're the only industrialized country that does not provide prenatal care to all of its mothers. You can cure that. Hope your Health Reform Act will do that. All of our children need to be able to get what they need regardless of the state they live in. Today, each state sets its own income eligibility level for CHIP and Medicaid, which results in a profoundly inequitable patchwork of eligibility across the United States. Imagine being a low-income parent or grandparent raising several children. One is eligible for Medicaid, the other is eligible for CHIP, with different income eligibility standards and benefit packages for each program. Why should a child in North Dakota be eligible for CHIP if their parents earn more than 150% of the federal poverty level, while in 12 states in the District of Columbia, families can earn twice that amount and children are still covered? Children's ability to survive and thrive and learn must not depend on the lottery of geography or birth. A child is a child wherever they live. They should have the comprehensive benefits. We must end this inequitable system. 10 states have no children eligible for Medicaid above 133%, but offer Medicaid to children in of all ages and families with income, but half of our states, offer Medicaid to children of all ages and families with incomes above 133% of the federal poverty line. Almost half cover children at 200%. 39 states offer CHIP to children to families between 185 and 400% of the federal poverty line. We urge a national eligibility floor of 300% for all children, pregnant women, wherever they live, and we should not force parents to have to choose between paying for child care, paying for health care, paying their rent, and so this is our chance to sort of give them the kind of national health safety net that I as a grandma have. I think I'm important, but I think my grandchildren are even more important, and we should treat them fairly. Secondly, we hope that all children will have the same comprehensive benefit packages, which include health and mental health coverage. We like the EPSDT program. It was designed and was appropriate for children. Children are not little adults. It has health and mental health coverage. We believe, and if you believe, that every child's life is of equal value and that children don't come in pieces and they should get what they have to have their conditions diagnosed and treated early and prevent later costs, I hope you will make sure that every CHIP child and every child in the exchange will get the same benefits that the Medicaid children get.
I hate to slow you down, but you're a minute over.
I'm a minute over already. Good gracious. Then thirdly, two last quick things, and I will just end, Mr. Chair. All of our eligible children should have simplified ways of getting and keeping enrolled. The bureaucratic barriers that keep 6 of the 9 million uninsured children now unenrolled need to be addressed. The package, as I see it, does not do that. We think that when we lay out in our testimony, our written testimony, and we lay out in specific legislative language in the All Healthy Children's Act, the steps that you can take to make Medicaid work. I'm glad you've moved to 133% of the federal poverty level for adults, but children are already eligible for 133%, but they're not getting it because of the bureaucratic barriers, which you must address through the simplification measures we lay out. And last, I just want to say, I know people are saying cost, and we can't afford it. Well, you know, we can afford whatever we want to afford. We do not have a money problem in a nation with a $14 trillion GDP. You found the money to bail out the banks. You found the money to bail out the insurance companies. You found the money to do the alternative minimum tax. We can find the money, if we believe in it, to make sure that we give our children the chance to survive and to thrive. And they are cost effectiveness. And while CBO may not score prevention, we know that $1 invested in immunization saves 16 on the other end. We know that if you give a child an asthma visit in a primary health care setting, is about $100 in Harris County, Texas. It's going to cost you $7,300. They go to the emergency room and have to be hospitalized. If we want to contain costs, children is the way to do it. All of them should be covered. All should get the same benefits. It should be simple and easy, and you have a great opportunity to do it right this year. Thank you.
Thank you.